Your dog's eyeball can pop out of its socket just from pulling too hard on a leash. It's called proptosis, and it happens to flat-faced breeds because their eye sockets are too shallow. Proptosis. Forward displacement of the globe beyond the eyelids due to shallow orbits, common after trauma or even mild restraint in brachycephalics. Clinical signs: eyeball protruding from the socket, inability to blink, conjunctival swelling, corneal drying or rupture, strabismus, extraocular muscle tears. Medical management: emergency lubrication plus globe replacement under anesthesia, temporary tarsorrhaphy, partial eyelid closure, enucleation if severe damage, pain control plus antibiotics. Long-term: prevent trauma, harness instead of a collar. Brachycephalic breeds are highly predisposed to ocular conditions.
Corneal ulceration, exposure keratopathy syndrome. Chronic corneal drying occurs because the eyelids cannot fully close, lag ophthalmos, and the eyes protrude more than normal. Clinical signs: squinting, blepharospasm, tearing or discharge, visible corneal defect or opacity, thick mucoid discharge, recurrent ulcers. Medical management: frequent lubrication, artificial tears, treat ulcers with topical antibiotics, conjunctival grafts or corneal surgery for deep ulcers, medial canthoplasty to reduce eyelid opening in severe cases.
Keratoconjunctivitis sicca, KCS, dry eye. Reduced tear production, causing chronic dryness and inflammation. Autoimmune in many breeds, but worsened by exposure in brachycephalics. Clinical signs: thick mucoid discharge, red irritated eyes, dry, dull cornea, pigment deposition over time. Medical management: cyclosporine or tacrolimus to stimulate tear production, topical lubrication. Treats secondary corneal ulcers. Monitor with Schirmer tear test.
Your dog's eyelid is literally folding inward and stabbing their own eyeball with their eyelashes every single blink. That's Entropion. You'll see them squinting constantly, tears streaming down their face, and dark staining on their cornea from friction. Entropion, especially medial canthal entropion, inward rolling of the eyelid margin, commonly at the inner corner, causing eyelashes or hair to rub the cornea. Clinical signs: excessive tearing, squinting, pigmentary changes on cornea, chronic irritation or ulcers. Medical management: temporary eyelid tacking in young dogs, surgical correction, medial canthoplasty for a permanent solution. Treat concurrent ulcers or infections.
Your dog's eyes are too big for their eyelids. Sounds weird, but it's called macroblepharon when the eyelid opening is so large they can't fully blink. Their corneas stay exposed, drying out. You'll see them tearing up, but still squinting. Macroblepharon is an excessively large eyelid opening relative to globe size, exposing more cornea to the environment. Clinical signs: inability to fully blink, chronic dryness, frequent corneal irritation or ulcers, epiphora, overflow of tears. Medical management: lubricating ointments. Medial canthoplasty to reduce the palpebral fissure. Manage secondary corneal ulcers early.
That brown-black spot on your pug's eye isn't dirt. It's their cornea turning black. Pigmentary keratitis starts small but spreads fast, stealing their vision one shade at a time. Pigmentary keratitis, very common in pugs, is dark pigment deposits on the cornea due to chronic irritation, inflammation, or friction from entropion or exposure. Clinical signs: brown-black pigment starting medially and spreading laterally. Reduced vision as pigment progresses. Mild to severe corneal irritation. Medical management: cyclosporin and tacrolimus to slow pigment progression. Lubrication. Correct entropion or exposure issues. Medial canthoplasty in advanced cases. Early intervention is crucial to prevent blindness.
My dog's eye kept tearing and squinting, and I thought it was just allergies. Turns out, hairs were growing from the wrong place inside her eyelid, scratching her cornea with every blink. It's called distichiasis, and without treatment, it causes ulcers. Distichiasis is abnormal hairs arising from the meibomian glands and rubbing on the cornea. Clinical signs: tearing, squinting, corneal irritation or recurrent ulcers, discomfort during blinking. Medical management: cryotherapy to remove hair, electroepilation, surgical removal for persistent cases, lubrication to protect the cornea.
Your flat-faced dog's constant eye gunk isn't allergies. It's their skull shape literally preventing tears from spreading across their eyeball. Those bulging eyes and shallow sockets mean every blink fails to protect them. Tear film abnormalities and chronic conjunctivitis. Brachycephalics often have poor tear distribution due to eyelid shape, globe prominence, and blink defects, leading to persistent inflammation. Clinical signs: redness of conjunctiva, mucus or watery discharge, chronic mild irritation, recurrent infections, tear staining. Medical management: lubrication and tear film stabilizers. Treat underlying causes: Entropion, KCS, distichiasis. Topical antibiotics, anti-inflammatories when infected. Eyelid surgery if anatomical defects contribute. Improve environmental humidity.
Brachycephalic dogs are more vulnerable to eye problems because their shallow eye sockets and wide eyelid openings leave the cornea exposed and easily irritated. These conditions can lead to discomfort, chronic inflammation, or even vision loss if not addressed early. With routine eye care, prompt treatment of irritation or injury, and regular veterinary checkups, most issues can be managed successfully. Staying proactive helps protect your brachycephalic pet's vision and ensures they remain comfortable and bright-eyed for years to come.